Ever wonder what's actually in a laceration cart? Today, we're joined by Dr. Ashley Peña, BAC, a local ER provider who's walking us through everything you'll find inside and what you'll use for wound repair. Stay tuned. Welcome back to the channel. I'm Dr. G, and in today's video, we're teaming up with Dr. Ashley Peña, a PA and seasoned emergency room provider right here in the Rio Grande Valley. She's giving us a hands-on look at the laceration cart, a mobile supply hub you'll find in most ERs and urgent care settings. Whether you're a student preparing for clinicals or a new grad trying to get your bearings, this is a great way to familiarize yourself with the tools and layout of a real-world lat cart. Let's join Dr. Peña and take a look inside.
Today we'll be looking at what a suture cart looks like. So this would be your basic suture cart. Some hospitals will have each drawer labeled. In this case, this drawer is not labeled. Keep in mind that if you ever need help, your nurse will help you out. This is also the room where all the supplies are at. So there's a lot of stuff going on. Most of the time they will have the suture cart stocked, however, and you can see that there's already one laceration kit up here. With a pad just in case, for a quick grab. Up here on the suture cart, you're going to see your different sutures. You're going to have anything from the non-dissolvable to the dissolvable sutures, chromic gut, satin, braided, not braided. And then of course you have the different sizings. Here you have 6, you have a 5 over here. You also have a 4.0, a 3.0. Usually the smallest that I'll usually see in the suture cart is a 3.0, but that's not to say that they don't have any others available. In the first drawer, you'll usually find, some extra scalpels. You're also going to find your steri strips, maybe a marking pen in case you need it, some little gauze that are separate, and then of course the measuring tape so that when you're documenting the size of your laceration or your wound, you can use that to do that. Here you'll also find a rhino rocket. Sometimes you're going to have those nosebleeds that don't stop, so you can also find your rhino rockets in the suture kits. In the second drawer, you'll usually find your filler needles, some iodoform, alcohol of course, and just some band-aids, and some basic gauze to wrap. Your third drawer, this drawer is pretty, well, it's not pretty at all, but you have some gauze. Again, you have some wrapping gauze as well, and then you have your tape. Oh, you also have your staple remover here. Keep in mind that your stapler remover and your suture removal will also usually be in this cart as well. Here you'll have your gloves. So you should already know your glove measurements by now. Here we have some 6, we have some 7s, 7.5s. Again, if you don't find your glove size here, just ask the nurse and they'll bring that to you. This drawer down here is just a variety drawer as well. This one, they don't have it stocked. They have some masks. Here you'll see some instant hot packs. The drawer back at the main hospital usually will have some laceration kits in here, but this is not the case in this one. And then your last one, you'll have your pads, and you'll have like your smaller pads, and then you'll have your larger pads. And that's about it. Again, each laceration cart is different. You can see the supply room is fully stocked of everything you may need. There are some derma bonds as well. The derma bonds are usually separate from the cart, and that's about it.
All right, so huge thanks to Dr. Peña for walking us through that laceration cart and sharing her real-world insight as an ER provider. If this video helped you feel more prepared for your next wound repair or clinical shift, go ahead and give it a like, and be sure to subscribe for more practical, hands-on clinical content. Have questions or requests for future videos? Drop them in the comments below. We're here to support your learning. Until next time, stay sharp, stay curious, and we'll see you in the next video.